Hi, welcome to another episode of Talking with Docs. I'm Dr. Brad Weenie.
And I'm Dr. Paul Zalzo.
Paul, first, I gotta tell you, we've done a lot of videos about sleep. You know, why you can't sleep after total knee, ways to get better sleep. If you're interested in that, go to our other videos. You know what's not a great way to get better sleep or to deal with the topic we're talking about today?
Give it to me.
Get a new puppy.
No thanks.
It's a bad way to get sleep and definitely does not require any treatment for constipation, which is the topic of today.
For you or for the puppy?
For the puppy.
Right.
Puppies just go when they want to go. So our topic today is constipation. Mostly for our patients, it's post-operative constipation, commonly with narcotics and pain medication. So we're going to talk a little bit about a way to try to prevent it as well as a way to deal with it once you get it, which can be complicated up to and including needing surgery.
All right.
So what's the best way to not get
Prevention.
prevention?
Prevention's always the best. Well, they say laughter's the best medicine.
I don't know that that's true.
Some of our comments would lead us to believe otherwise.
I would agree.
Prevention, though, that's up there with the best medicine.
So how can people prevent getting constipated?
They can prevent getting constipated by avoiding things that lead to constipation. One of the things is surgery, right?
Yes.
So if you don't have surgery where you're taking a lot of medications that slow motility in your gut down, narcotics definitely do that. So that's your codeine, your oxycodone, your hydromorphone.
All the things that we prescribe after total hip and knee replacement.
Yeah, those things slow down the motility in your gut and they can lead to constipation. So avoiding those kind of things helps minimize your chance of getting constipation, that's for sure.
For sure, eating a healthy diet up to and before surgery, you know, obviously more plants and vegetables, lots of natural sources of fiber, and lots of water. So people commonly get dehydrated up to surgery because you're not eating or drinking for a little while before, but it's usually not the 12 hours that's the problem, it's days and potentially even weeks leading up to it. So, okay, so now you're in the hospital, you're home or whatever, and you're constipated. So now you failed the prevention side, strike one. How do you deal with it once you are constipated?
I like to think of it as the BOSS.
Okay, that's a nice acronym. I like it.
Sorry, Bruce Springsteen, but the acronym BOSS will stand for the following things that you can do if you do develop constipation. Why don't you go with number one?
Okay, number one is the bulk forming agents. So these are the most common, the beef and the BOSS. So you go to your pharmacy and these are the Metamucils, the Benefibers, all these fiber type therapies. And we actually have a great hemorrhoid video that talks all about how fiber therapy helps reduce hemorrhoids. It also helps keep your stool big. It makes it big, which ironically makes it pass easier.
That's a great video about hemorrhoids, not a great hemorrhoid video.
Right, fair enough. There are no hemorrhoids shown in the video.
Oh, that's a great hemorrhoid.
That's right, wow.
Osmotic,
Okay, it's a fancy term.
It's a fancy term, but you learned about it in maybe grade 8 or so in science. Osmotic. Osmosis is the way that you move water from an area of a low concentration of solute to a high concentration of solute.
Yes, through a semi-permeable membrane.
Yeah,
all that
you
stuff.
remember that.
Yeah.
It draws water across, right? So osmotic agents such as lactulose, for example, is something you can take that will help move that stool along.
Right, so now we've tried to make it bigger, we've tried to make it wetter, which also makes it softer, and then number three is in the S, or the BOSS, is stimulants. So something that actually gets your bowels to contract and essentially push it forward down the tube to exit your body. So this would include things like Dulcolax. It's commonly prescribed orally, so this can allow you to stimulate your bowels to help you rather than just straining to void.
It's also available in the suppository.
It sure is, 100%.
Number 4, so we got BOS.
Yep.
BOS. Now to make it BOSS, we've got the last thing, which is a stool softener.
Okay, so say you've done all those things, and this sometimes can be a period of hours or even a couple of days. You give it a try, and then you're getting more nervous because you're at home. You're like, I haven't had a bowel movement in 3 days. I'm really uncomfortable. I might be getting some abdominal pain. I'm getting a little bit distended. So you've tried the oral way. What's the next way?
I'd go get medical help. If you're getting to the point where you're distended and and it's been more days than usual for you, then definitely go get some medical attention.
Yes. And then what I was kind of getting at is that the next thing after oral is to consider a suppository.
Yes.
Some people are comfortable doing this on their own, depending on the frequency of their bowel movements or if they've had trouble in the past. So a suppository. What else could they do?
Well, if the suppository is not working and you've tried the BOSS approach, now you're, getting medical attention. probably an enema is your next step.
Right, I remember the fleet, for whatever reason, was the one that rings true for me, and the nurses on the ward would say, so-and-so's constipated, can we have a fleet enema? You're like, yeah, give a fleet enema.
Yeah, it's kind of worse because fleet implies a lot of people coming in.
Or a whole bunch of ships.
Fleet of cars,
yeah,
fleet of shit.
Yeah.
Usually doesn't need that.
No. Okay, so you've done all that. Most often, this is going to be successful to get you moving. So what happens though if you have a bowel, or if you have bowels that are constipated for a prolonged period of time? Can it be dangerous?
Yes, it can be
Okay.
dangerous. It's not good to keep that in.
Okay.
Because you can lead to what's called a bowel obstruction. Okay.
Sounds serious.
And this is one thing we keep an eye out for after surgery. Okay, we call it a post-op ileus.
Yep.
Okay, and that's where your bowels just get obstructed and they're not moving, and that can be life-threatening.
Right.
Because you could rupture your bowel at some point.
Yes.
But that it takes a while to get to that. But definitely something we worry about post-op for these post-op ileuses, and it's post-op constipation that gets uncontrolled, and sometimes it's even surgery is required.
Yeah, so you have pain, you have abdominal distension, sometimes you even vomit.
Yeah.
So yeah, that definitely requires urgent medical attention, and yeah, usually we refer to our general surgery colleagues, and they do a combination of things.
Yeah, first they do a trial of putting in an IV because you're getting a little bit dehydrated with this, and stopping eating, nothing to eat or drink for a while till your bowels settle down. Often they'll put in an NG tube, a nasogastric tube that goes in through your nose down into your stomach to drain any contents there, and then do that for a few days until we start hearing bowel sounds. Then you start passing gas, and then hopefully eventually have your bowel movement.
In residency, we were obsessed with bowel sounds, weren't you, on general surgery
That
rounds?
stethoscope, listening.
Nothing.
Well,
got some gurgling.
You worry if you hear nothing. So that's sort of the deal. That's why we worry about it so much. That's sort of the relevance that comes into us as orthopedic surgeons. It's something that can happen to you after surgery.
Yeah, so most important thing, try to prevent it. And then if you feel like it's starting to happen, try to get in front of it, no pun intended. And then last, obviously, if you get really sick or you feel like you're not making any progress, then seek attention, whether that's your family doctor, your pharmacist, or to the emergency room potentially.
Yeah, and with our surgical population, that's one of the reasons we like to get you up moving around.
Right, critical.
Because that can help minimize shit. If you just stay lying around, it's hard for your bowels to get going. But if you're up moving around, walking and stuff like that. And that's the thing I often say, once you get moving, you'll feel better.
Absolutely.
Once you get bowel moving, you'll feel better.
Once you get bowel moving. Well, there you go. If you like this video, please like it, subscribe to our channel.
And remember, you are the boss of your own health.
We'll see you next time.